Welcome to my channel. My name is Wendy. I am a registered nurse, and on my channel, we talk about all things nursing. If this is your first time on my channel, go ahead and press that subscribe button and follow me on my journey through nursing. Today, we are going to talk about whether or not you should work as a CNA or a nursing assistant while you are in nursing school. Stay tuned. So if you've stumbled on this video, it's because you are trying to figure out if it would be beneficial to you to work as a CNA while you're in nursing school. Let me give you a background about myself. I graduated with a Bachelor's of Science degree in kinesiology. And during the summer of my second year in college, during my undergrad, I went and took some classes to get my CNA license in California. Whilst I was completing my Bachelor's of Science, I was working as a CNA. Once I was done with that bachelor's, I continued to work as a CNA all the way through nursing school. So what does a CNA do? The scope of practice of a CNA are to take vital signs. This includes taking the temperature, blood pressure, oxygen level, and heart rate of the patient. The CNA helps to reposition and turn patients every 2 hours for those who are bedbound. The CNA also answers patient calls, helps with medical procedure that the nurse would be doing, such as inserting a Foley catheter. The CNA also changes linens, makes sure the patient's room are clean, also documents in a charting system, and reports any changes seen by the CNA of a patient to the RN. And lastly, in helping the RN with certain medical procedures, the CNA also helps the nurse with some dressing changes, if needed by the nurse. The CNA works in settings like home health, hospital, an acute care center, or a long-term facility, usually referred to as the SNF. The CNA can also do private duty, work for assisted living. There are many different places that you can find a CNA working. It's interesting because a CNA can also be found working at a correctional facility as well. There are many places that a CNA can work at, so do not limit yourself to just a hospital or a nursing home. Think outside the box. There are a lot of jobs out there for CNAs. Usually, before you can work at an acute care facility like a hospital, most hospitals require the CNAs have 6 months to a year's experience working at a nursing home. Since I went to school in a small town up north California, my first job was actually at an acute care facility. It was a community hospital, and they didn't require that I have that experience in a nursing home before starting at that hospital. And I was happy and gladly to take it. So I learned most of my skills, if not all, in that hospital. The benefits of working as a CNA before or during nursing school is that, one, you get preview to a lot of different things that you would do as a nurse, as an RN. You get comfortable with interacting with patients. You get comfortable maybe emptying a Foley. You get acquainted to a lot of different medical equipment that you wouldn't normally get preview to until you get into nursing school. I know it helped me out a lot. There was a time when I was in nursing school and we were talking about telemetry, and we had to learn how to place the leads on a patient. For me, it was easier because it was something that I did all the time working as a CNA. That's definitely one of the benefits of working as a CNA before getting into nursing school. Another reason is that you get to learn and have some money in your pocket while you're at it. And some jobs require that you work 12-hour shifts, so you don't only get paid, but you also get used to working 12-hour shifts that RNs usually work. So you're learning, you're getting paid, and you're getting used to an environment that you will ultimately be working under. Another benefit is that working as a CNA helps you get your first RN job. I used my experiences working as a CNA during my interviews for my first RN jobs, and I feel it helped to set me apart from other applicants. Now, the drawback of working as a CNA while in nursing school was really the scheduling. Scheduling was hard for me just because I was working 8-hour shifts and not 12-hour shifts. I worked part-time, so as a part-timer, I had to work 3 shifts per week. Whereas if I was working 12-hour shifts, the part-time requirements would be 2 days a week. And my nursing schedule of having classes and clinicals, also factoring study time, made it very hard for me to make those work. The way that I handled that was by giving my shifts away. I always needed at least 1 day out of the week to devote to studying or to meet up with my study group. But overall, working as a CNA was helpful to me. I always took it like a second clinical day for myself. Whenever I went to work, I would take the opportunity to ask the nurses about certain things that maybe I didn't understand in school or in my classes. I would also use it as the opportunity to really think about what the nurses are doing on a day-to-day basis. My fundamental class also helped me to understand why both CNA and RNs do certain things as well. So it kind of puts a purpose and a reason behind everything you do while you are at work. Also, I want to mention that the type of shift you're working, whether it's day shift or night shift, makes a difference. The area in which you're working. Working a med-surg versus a psych unit would require different practices. Whereas med-surg, you're a little bit more hands-on, doing things all the time. Whereas in psych, you might get some downtime that would help you to study. When I was in nursing school, if I had to work, I was always looking for a sitter assignment. That is because as I'm sitting down, I always go prepared to work with some questions on my phone. So when I'm sitting there watching the patient, if I can look away, I look down at my questions to kind of go over and review some of my study materials. Also, a per diem CNA job helps you to be flexible with your time in that you can plan your work schedule around your nursing school schedule. So keep in mind that there are a lot of options out there. If you really want to go and get your CNA license to work as a CNA before or during nursing school, it is definitely doable. I did it, and I know that you can do it. It just requires a little bit of time managing and making sure that you are setting the time to study for your nursing classes. Because at the end of the day, that is the priority. If you can't go to work, don't go. But if you can work and still study, then that's a big plus. Also, keep in mind that if you are in nursing school, you don't need a CNA license to work as a nursing assistant. You can use your experience as a student nurse to apply for some of those positions or for student nursing positions. I hope this was helpful. This is my take based on my experiences on whether or not you should work as a CNA whilst you're in nursing school. It was helpful to me, and I'm sure it will be helpful to you, only if you are able to do it. Please do not make yourself do anything that will hinder your chances of passing your classes in nursing school. And again, if you've been watching me or if this is your first time on my channel, go ahead and press that subscribe button for me and follow me on my journey through nursing. If you have any questions, comments, concerns, definitely put them down in the comments section below, and I'll be sure to get back to you. Until next time, bye-bye.